Hi, this is Kamaria Harris, and I am doing my YouTube presentation on depression. And I chose depression because it is a serious medical problem that is poorly recognized by healthcare provider in the primary care setting. Depression affects 20 million Americans each year, and only 30% of these patients will seek service. 1 in 7 patients will commit suicide, but what's unfortunate in the literature is that 70% of these patients that commit suicide were patients that were seen in their doctor's office 6 weeks prior to taking their life. And so it is my goal that I could come up with a screening tool that can be incorporated into the patient electronic medical record that would help primary care provider increase their comfort level and knowledge in screening, recognizing, and treating depression. And so the patient health questionnaire is the screening tool that is most commonly used, and it is most commonly used because it is basically relies on the patient's self-report of depressive symptoms over the past 2 weeks. And in order to make a definitive diagnosis, the clinician have to make sure that she verifies all the question with the patient so that she get an understanding that the questions were understood on the questionnaire. And so the first thing I would like to do is I would like to gather patient history. I would like to know about any personal or family history for depression or any other mental disorder. I want to know about any drug or substance abuse, since those two correlates with each other. I also want to ask about any medication that they're taking, such as the benzos and the barbiturates and the antihypertensive that may mimic some of the symptoms of depression. I also want to ask them about any suicidal thoughts or any prior attempts at suicide. I also want to find out about their sleeping and eating habits. And then I do want to assess for outward appearance. I want to look for any neglected hygiene. I also want to look and see if they look tired appearance, if they look sad or irritable, if they have any impaired concentration. Look for pale skin. And so in doing that, the next thing I would like to do is try to help diagnose these patients. And I think that's where the problem comes in, is that the symptoms of depression mimic so many other conditions, such as hypothyroidism, for instance. Most patients will feel fatigue and have insomnia, and I think this is where nurse practitioners have a difficult time because the symptoms are so similar to other conditions. And so the first thing you want to do is to assess your patient. And so if a patient comes in for 3 or more visits and they're complaining of headache, recurrent headache, low back pain, insomnia, abdominal pain, then you want to use that to determine that there's something going on. And so there's 2 questions that you can ask these patients. Over the past 2 weeks, have you had any depressed mood? Over the past 2 weeks, have you felt little interest or pleasure in doing things? And so if they answered yes to these, and this is where the patient health questionnaire comes into play. And so you do want to ask them these questions. And there's 9 questions, and then there's a 10th one at the bottom. And so the scoring is 0, meaning not at all. 1 is several days. More than half the day is 2. Nearly every day is 3. So the scoring is 0 to 3. And so based on what those scores are, you tally up those scores and you give them the total number. And so if they score 1 to 4, then they're minimally depressed. 5 to 9 is mild depression. 10 to 14 is moderate depression. 15 to 19 is moderately severe depression. And 20 to 27 is severe depression. And so to ask them a question of 9 questions. At the bottom, there's a 10 question that says, if you checked off any problem, how difficult have these problems made it for you to work, take care of things at home, or get along with other people? And so it would be their choices are not difficult at all, somewhat difficult, very difficult, and extremely difficult. So I'm hoping that this will be a tool that could be implemented into the patient screening when they come in for a routine visit. And if they screen positive, then the nurse practitioner or the provider need to make sure that they start them on treatment, which is the antidepressant, the SSRI, the NSRI. However, due to the black box warning, most people are reluctant to take those medications, and also the side effects that comes along with it, and the fact that it takes 4 to 6 weeks to take effect. Also, the screening tool takes about 5 to 10 minutes, so it should be quick for anyone to use. That's the end. Thank you.